EACTAIC Fellowship Seminars, Series 2, Episode 1, Perioperative Hemodynamic Monitoring. The EACTAIC Education Committee has organized the seminar episode in collaboration with the Leuven University Leuven, Belgium. The Leuven University Leuven, Belgium supported this seminar episode. How to register. It is simple. Type or copy the link below to your browser. https://www.eactaic.org Event Perioperative Hemodynamic Monitoring. Please register to get the certificate of attendance. Please contact EACTAIC Seminar at aimgroup.eu. If you do not receive your link within 48 hours after the registration, please note that registrations are only possible until 5:25 p.m. Rome time, on February 6, 2023. Registrations sent after that time will not be accepted. What's in it for me? After participating in this seminar episode, you will better understand, the place of the perioperative use of the pulmonary artery catheter in the modern cardiac anesthesia era, the advantages and limitations of using transpulmonary thermodilution for advanced monitoring in hemodynamically unstable patients, the limitations of invasive arterial blood pressure monitoring derived from the radial artery in patients undergoing cardiac surgery, the risk factors for the development of an attenuated radial blood pressure post-CPB and how to detect a central to peripheral pressure gradient non-invasively. To know more about the program, opening and introduction by the program director, Dr. Dieter van Beersel. Dr. Dieter van Beersel finished his specialty training in anesthesiology at the Catholic University of Leuven in 2015. After completing fellowship training in cardiac anesthesia and TOLV Clinic Aalst, Belgium, and intensive care medicine, Zaltjank, Belgium, he started working as a staff member in the Department of Anesthesiology at the University Hospitals Leuven in 2018. Dr. van Beersel's main clinical interests include cardiothoracic anesthesia, hemodynamics and thoracic organ transplantation. Is there any place for the PAC in modern cardiac anesthesia? Professor Stefan Rex and Dr. Van Zale. Professor Stefan Rex. He is the EACTAIC Scientific Chair, Consultant, Department of Anesthesiology, University Hospitals Leuven, 2011 Current, Associate Professor of Anesthesia, Department of Cardiovascular Sciences, KU Leuven, 2011 Current, or Coordinator, Department of Anesthesiology, University Hospitals Leuven, Belgium, 2012 Current. Dr. Albert Van Zale. He is a current EACTAIC Fellow at University Hospitals Leuven, KU Leuven, Belgium. He is a qualified general anesthesiologist in his home country of South Africa and an active member of the South Africa Society of Anesthesiologists, SASA. He is affiliated with the University of Stellenbosch and Tygerberg Hospital, where he was working as a staff member before embarking on a fellowship. Transpulmonary thermodilution, advantages and limitations. Professor Xavier Monet. He is Professor of Intensive Care at the Paris-Saclay University. He works in the Medical Intensive Care Unit of the Bicêtre Hospital, Paris-Saclay University Hospitals. Dr. Monet's main fields of research investigation are acute circulatory failure and its treatment, hemodynamic monitoring and heart-lung interactions. He has written several book chapters and didactic reviews, and is the author of more than 200 scientific articles in peer-reviewed journals. He is currently the chair of the cardiodynamics section of the European Society of Intensive Care Medicine. Can we trust radial artery pressure monitoring during cardiac surgery? Dr. André Denault and Dr. Matthias Jacquet Lagrez. Dr. André Denault. He is an academic physician with special interests in ultrasound. Dr. Denault has written 317 peer-reviewed articles, 60 book chapters and 3 textbooks on perioperative transesophageal and critical care ultrasound. He also won several teaching awards including the Canadian Anesthesia Research Award in 2022. Dr. Denault currently works as a cardiac anesthesiologist at the Montreal Heart Institute in Canada. His major areas of interest include right ventricular function, bedside whole-body ultrasound and is considered a world expert in the field of brain and somatic oximetry. Dr. Matthias Jacquet Lagrez. He is an intensivist and anesthesiologist working since 2018 in the Département of Intensive Care and Anesthesiology in Hôpital Louis Pradel Lyon, France. He was a fellow at the Montreal Heart Institute between 2017 and 2018. He works as a clinician and as a clinical researcher. His fields of interest are peripheral perfusion, Microcirculation and echocardiography. Q&A. Ask the faculty. Closing. Professor Mohammed El Tayan, EACTAIC Education Chair. We look forward to welcoming you in Leuven.